the all-important bill for an act to provide the legal framework to establish a federal medical center, Bonny, Rivers State, for related matters, HB 963. I so move.
Tuesday, 22nd March 2022 remains indelible in the minds of residents of Bonny Island, Rivers State, as on this day, the House of Representatives passed into law the bill for the establishment of a federal medical center in Bonny local government area of Rivers State. Bonny is an island with a population of about 172,549 persons due to the consistent surge in the population owing to the oil explorative activities constantly ongoing on the island, with the figure estimated to increase drastically, especially with the construction of the Train 7 of the NLNG in progress. The island grapples with many security challenges on the waterway as well as health issues. The surge in cases of COVID-19 pandemic, coupled with the case of death of strange fishes found around Bonny and Donny waterway, led to many deaths in the island, stretching the primary healthcare centers in the area. Sadly, the few existing health facilities in the area, which look more like consulting clinics, are not capable of handling serious health-related ailments or emergencies, let alone withstand an outbreak of serious epidemic or hazards caused by industrial or social-related activities. The absence of a good secondary healthcare facility has therefore remained a concern to residents as they clamor for the provision of an improved healthcare system to bridge the health infrastructure deficit in the local government area and provide for the health needs of the locals and foreigners alike. This informed the bill which seeks to establish a federal medical center in Bonny Rivers State, sponsored by Honorable Dr. Farah Dagogo, member representing the Gema Bonny Federal Constituency, with 12 other members from Rivers State as co-sponsors. Farah Dagogo had in his debate lamented the healthcare neglect Bonny Kingdom was facing, despite being host to the multi-billion-dollar Nigerian liquefied natural gas NLNG and other oil multinationals, adding that the availability of a good healthcare facility ought to be a matter of grave concern to the government.
Bonny is an island that grapples with many security challenges on the waterways. Issues of piracy and kidnappings are at the crescendo. Thus, this has implications for free movement to and fro the island. Consequently, therefore, no medical center in the area can withstand an outbreak of serious epidemic or hazard caused by industrial or social-related activities.
The House Committee on Health Institutions had on February 1, 2022, laid its report before the House for consideration and adoption. At the Committee of the Whole penultimate Wednesday, chaired by the Deputy Speaker, Honorable Idris Wase, the House scrutinized and considered the sections, schedule, and explanatory memorandum, where further amendments were effected. At a one-day public hearing at the House of Representatives, critical stakeholders threw their weight behind the proposed law. The bill was later adopted at the resumed sitting of the House. When it was put up for third reading, the bill got a resounding yes and was consequently passed into law. With the passage of the bill, the lower chambers has granted legal framework to the establishment of the Federal Medical Center. The medical center will cater for and address the consistent surge in the population of Bonny and Rivers State at large, and when fully operational, would generate employment, reduce the number of job seekers in the labor market, reduce crime rates, and improve security in the local government. EUNICE, EMEYAZIA reporting.